Well, in severe mental illnesses, especially the psychiatric disorders, the person is lost in his own world because there will be serious impairment in thought processes. The person is bothered by hallucinations and delusions, and in most cases, unaware of the severity. So, the family members they should take the initiative. And the person who is suffering from psychiatric illnesses, he feels that he is okay and the world is not alright. Well, in less severe and non-psychotic or anxiety disorders, the level of personal discomfort and feelings of inadequacy will determine the need for intervention. Because in the near and dear ones, sometimes they may ask you to go meet an astrologer or perform this puja or that puja. I don't dissuade people from performing any of those things, but they must also seek professional help. When the person is not able to function at an optimum level, like for example, hold on to a job, deal with family and friends, maintain interpersonal relations meaningfully, pay the bills on time, and when there is a gradual decline in the personal care and also in the academic performance, or when there is a decline in managing the daily routine or the day-to-day activity as we call it, and when there is a noticeable difference in the personal hygiene and the sleep pattern, these important indicators should be taken into consideration, and all these things definitely warrant professional intervention. Well, if the need for professional help is felt by the person or the family, it is always helpful to seek the advice of a professional. Professional people will have a good knowledge base and experience that will help them tide over the problem. Stigma is a social reality we have to manage. Severe mental illnesses are treatable and the person can be made functional. Near normalcy can definitely be achieved through medication and psychosocial intervention. That means taking a decision is very, very important because many people are very indecisive when it comes to seeking. In fact, many severe mental illnesses are just passed off as mere idiosyncratic behavior. Well, taking decision to seek help is not easy at all for many people. So the best thing would be to share your concern seeking help. Speak with your family members, friends, well-wishers, and caring colleagues, sometimes even caring boss. Seeking information on the internet is definitely good, but don't get overawed by the slew or deluge of information. This information should be converted into knowledge, that into wisdom with the help of people in the field. I mean the experts. Well, meet the professional or the expert at the first instance to get a better clarity of the symptoms of the illness. Consulting a psychiatrist is a must because in severe mental illnesses, medications are very, very important because to manage symptoms. Highly symptomatic psychiatric illnesses needs medication because there are a lot of upheavals in the neurotransmitters that has to be managed. That can be done only through the help and advice of a psychiatrist. Well, it is your right to be informed about the nature of the illness, prognosis, medications, and other side effects. Many uh, people have asked me this question. What about the side effects? Yes. No doctor ever prescribes side effects. He only prescribes medication. Side effects may happen, may not happen. Do not hesitate to ask questions. If you couch your question in vague terms, you only get vague answers. And psychiatrist may recommend that you also seek the help of a counselor or a mental health professional, a clinical psychologist or a therapist or a psychiatric social worker who can offer additional therapies to deal with mental illness. Medication is not all. Make sure you are comfortable with professional that you meet. Wives have to be good. He or she must listen to you, spend a lot of time with you, and be willing to share his knowledge, information, and discuss your problem. You may not hit a right card with the professional at the first instance. In that case, seek a second opinion of another professional. Help is available and you have to seek the help.